Good day, I am Natasha Marie Taniedo, and I'll be demonstrating a complete bed bath to a patient. The first thing we need to do is to review chart for any limitation in physical activity. Identifying limitation prevents patient discomfort and injury. Now we bring all the necessary equipment to the bedside stand and perform hand hygiene and put on gloves. Hand hygiene prevents the spread of microorganisms. We identify the patient, we discuss the procedure with the patient and assess the patient's ability to assist in the bathing process. Then we provide privacy. This ensures the patient's privacy and lessens the risk for loss of body heat during the bath. Adjust the bed to a comfortable working height, usually elbow height of the caregiver. Having the bed at the proper height prevents back and muscle strain. Put on gloves, lower side rail nearer to you and assist patient to side bed where you will work. Loosen top covers and remove all except the top sheet. Place bath blanket over patient and then remove top sheet while patient holds bath blanket in place. Remove patient's gown and keep bath blanket in place. This provides uncluttered access during the bath and maintains warmth of the patient. Fill basin with a sufficient amount of comfortable warm water and put on gloves if necessary. Fold the washcloths like a mite on your hand so that there are no loose ends. Lay a towel across the patient and top of bath blanket. This prevents chilling and keeps the bath blanket dry. With no cleanser on the washcloth, wipe one eye from the inner part of the eye, near the nose, to the outer part. Rinse or turn the cloth before washing the other eye. Bath patient's face, neck, and ears, and then apply appropriate emollient. Then expose patient's forearm and place towel lengthwise under it. Using firm stroke, wash hands, arm, and axilla, lifting the arm as necessary to assess axillary region. Rinse if necessary and dry, then we apply appropriate emollient. The towel helps to keep the bed dry. Washing the far side first eliminates contaminating a clean area once it is washed. Gentle friction stimulates circulation and muscles and helps remove dirt, oil, and organisms. Long, firm strokes are relaxing and more comfortable than short, uneven strokes. Rinsing is necessary when using some cleansing products. Use of emollient is recommended to restore and maintain skin integrity. Then we place a folded towel on the bed next to the patient's hand and put basin on it. Soak the patient's hand in basin. Wash, rinse if necessary, and dry hand. Apply appropriate emollient. Placing the hand in the basin of water is an additional comfort measure for the patient. It facilitates thorough washing of the hands and between the fingers and aids in removing debris from under the skin. Use of emollients is recommended to restore and maintain skin integrity. Then we repeat the actions on the other side. It is an option for the shorter nurse or one susceptible to back strain might be to bath one side of the patient and move to the other side of the bed to complete the bed bath. After that, we return bath blanket to original position and expose far leg. Place towel under far leg. Using firm stroke, wash, rinse if necessary, and dry leg from ankle to knee and knee to groin. Then we apply appropriate emollient. The towel protects linens and prevents the patient from feeling uncomfortable from a damp or wet bed. Washing from ankle to groin with firm stroke promotes venous return. Use of emollients is recommended to restore and maintain skin integrity. Wash, rinse if necessary, and dry the foot. Pay particular attention to the areas between toes. Then we repeat the action for the other leg and foot. Then make sure patient is covered with bath blanket. Change water and wash clothes at this point or earlier if necessary. The bath blanket maintains warmth and privacy. Clean, warm water prevents chilling and maintains patient comfort. Then help patient put on a clean gown and assist with the use of other personal toiletries, such as deodorant or cosmetics. This provides for the patient's warmth and comfort. Protect pillow with towel and groom patient's hair. When finished, make sure the patient is comfortable with the side rails up and the bed in the lowest position. Proper positioning with raised side rails and proper bed height and hygiene prevents the spread of microorganisms. Next is shampooing a patient's hair in bed. First, we review chart for any limitation in physical activity or contraindication to the procedure. Perform hand hygiene and PPE if indicated. Hand hygiene prevents the spread of microorganisms. We identify the patient and explain the procedure to the patient. Gather all the materials as needed. Then we provide privacy. Lower the head of the bed, remove pillow, and place protective pad under patient's head and shoulders. Position the client at the top of the bed in a supine position. Have the patient lift his head or her head and place shampoo board underneath patient's head. If necessary, pad the edge of the board with a small towel. Warm water is comfortable and relaxing for the patient. It also stimulates circulation and provides for more effective cleaning. Padding the edge of the shampoo board may help increase patient comfort. Place a drain container underneath the drain of the shampoo board. The container will catch the runoff water, preventing a mess on the floor. Put on gloves if the patient is able. Have her hold a folded washcloth at the forehead. Pour pitcher of warm water slowly over patient's head, making sure that all hair is saturated. Refill pitcher if needed. Gloves prevent the spread of microorganisms. A washcloth prevents water from running into the patient's eye. By pouring slowly, more hair will become wet and it is more soothing for the patient. Then we apply a small amount of shampoo to patient's hair. Massage deep into the scalp, avoiding any cuts, lesions, or sore spot. Shampoo will help to remove dirt or oil. Then we rinse with warm water, 48 degrees to 46 degrees Celsius, until all shampoo is out of hair. Then we repeat shampoo if necessary. Shampoo left in hair may cause fritus. If hair is still dirty, another shampoo treatment may be needed. Then we remove shampoo board, place towel around patient's hair. This prevents the patient from getting cold. Pat hair dry, avoiding any cuts, lesions, or sore spots. Remove protective padding but keep one dry protective pad under patient's hair. Patting dry removes any excess water without damaging hair or scalp. Gently brush hair, removing tangles as needed. Removing tangles helps hair to dry fast. Brushing hair improves patient's self-image. Then we change gown and remove protective pad, replace pillow. If patient's gown is damp, patient will become chilled. Protective pad is no longer needed once hair is dry. Remove equipment and return to patient to a position of comfort. Then remove gloves, raise side rail, and lower bed. Promotes patient comfort and safety. Removing gloves properly reduces the risk of infection, transmission, and contamination of other items. Then remove additional PPE if used. Then we perform hand hygiene. Removing PPE properly reduces the risk of infection, transmission, and contamination of other items. Hand hygiene deters spread of microorganisms. Then next is assisting the patient with oral care. First, we perform hand hygiene and put on gloves if assisting with oral care. Hand hygiene and PPE prevent the spread of microorganisms. Then we identify the patient, explain procedure to the patient. Identifying the patient ensures the right patient receives the intervention and help prevents error. Explanation facilitates cooperation. Then we gather all the equipment on our bed table within patient's reach. Then we provide privacy. Closing the door or curtains provide privacy. Placing brush at a 45-degree angle to the gum line. Brushing the gum line to the crown of each tooth. And then we gently brush the tongue. Then hold emesis basin for patient to rinse and spit. And lastly, giving the patient a back massage. First, we perform hand hygiene and identify the patient. Offer a back massage to the patient, explain the procedure. Put on gloves if necessary. Provide privacy and assess the patient's pain using an appropriate assessment tool and measurement scale. Raise the bed to a comfortable working position, usually elbow height of the caregiver. Patient safety and lower the side rail. Assist the patient to a comfortable position, preferably the prone or side lying position. Remove the covers and move the patient's gown just enough to expose the patient's back from shoulder to sacral area. This is euplerge or stroking. Euplerge is a type of massage consisting of long, slow, bleeding stroke. This rub has relieving and sedative effect. Next is friction. These movements are in circular nature. It is performed with the help of the thumb and finger pads. It is also help in reducing swelling after nerve inflammation. Next is tapotement. This involves hacking, tapping, beating, and clapping. Tapotement helps in accurate condition of the muscle. It increases the blood supply and strengthens muscle. It is a rhythmic movement done with the edge of the hand, a cup, hand, or the tip of the fingers. Kneading is a part of the Swedish massage tradition and involves the grasping and lifting tissue. This is performed with palms pressing down on muscular tissue and lifting it with the fingers in a rhythmic and turning position.